COVID-19 numbers up in Colorado. So our 9Health expert, Dr. Payal Kohli, is back with us to try to add some context to that. Any reason why we're seeing those hospitalizations going up around Colorado while the rest of the country seems to be trending down at this point?
Yeah, we're scratching our heads about this one. And a part of it is that not so much that everybody else is going down, but more that we're staying the same. We're not going down with everybody else. So we're not going up quite as much. But I think the first reason, Tom, is infection begets infection. So when you have a lot of infection in the community, which we do right now, in this highly contagious virus, it is likely to spread. The second is, if you look at our profile of who's received which vaccine, we have a lot of Pfizers. In fact, that was the one that was given most commonly. And it started about 6 months ago. And we know that right around the 6-month mark or so is when that immunity really starts to go down. Yeah. And then third is our behavior. As you've seen, we've got ball games again, which I love, of course, but we're getting together, we're going out to eat. Those outdoor seating spots are becoming a lot less popular at the restaurants now.
Yeah. So the positivity rate today, above 8% at this point, that does seem really high, especially since we seem to be doing okay with vaccinations here.
Yeah, Kim, that's incredibly high. So remember how we had talked about that threshold of 5%, reflecting a good place?
Right.
That was pre-vaccination.
Right.
Now that we're vaccinated, we really need to be way below that. And remember, positivity reflects two things. One is a lot of infection in the community, which we know we have, but two is not enough testing. And now that a lot of us are vaccinated, we're not leaning on testing nearly as much as we should. Now, the caveat to all this is that I'm hoping more of us are doing at-home testing, that they're not then reporting to the city and county of Denver and to the state of Colorado. And maybe that's why the rate is so high, but I'm really worried. In the setting of vaccinations, we should see this way lower than it is.
Yeah.
I'm worried now because we still are in summer weather. I mean, we have yet to be driven inside, and where the flu season and where COVID again has that opportunity to be a little more vibrant in our lives. Is that legitimate to consider that to be an important factor?
Hugely legitimate for two reasons. One, as you alluded to, our behavior. And two is the behavior of the virus, that it actually has more survivability in the air. Those aerosol droplets we talked about in colder weather, colder, drier weather, just like we have here in Colorado. So I am concerned because last year at this time, there was no going out, there was no getting together, and we had a lot less contagious version of the virus. Now we've got vaccinations on board, and yet we're seeing this kind of positivity, and we're headed into winter where we're all going to start getting together indoors.
We're all going to be inside. Yeah, that is scary. I see so many people wearing masks, though, in places where it's not required, which I think is people taking it really serious, too. People that are fully vaccinated, committed to the mask at this point. So we talk about hospitalizations. We've been talking about that, too, as kind of a metric to know how this disease is spreading in our community. What else should we be following and what else should we pay attention to?
So it's not just the hospitalizations, but who's getting into the hospital that I think is really critically important. Are they those vaccinated individuals or the unvaccinated? So initially, early on, when we had a rise in hospitalizations, we were seeing mostly unvaccinated. Now we're slowly seeing that vaccinated number creep up. It's up to 21% now in the hospital. So 2 out of every 10 people that are vaccinated and ending up in the hospital. And again, that really reflects the infection in the community causing those breakthrough cases, but also tells us we need to ramp up our efforts on the boosters.
A couple of things I still want to talk to you about. We'll have to do it the next time you visit, but obviously a lot of discussion about Colin Powell's passing from COVID complications and what his immunocompromisation had to do with that. And also this news today about mixing and matching now becoming closer and closer to reality, and some counsel on that. But we'll have to do that when we get a little more time, and we'll have you back. Of course, we always love to visit with you. Thanks, Dr. Payal Kohli.
A lot more coming on that one for sure.